In previous section, we have trained users on how to log into their account, how to attend to patients. At this stage, we'll be looking at how to carry out clinical patient care using HealthServe. So to start with, the first thing you do is to log into your account on the system as a healthcare professional. So when you log into your account, the next thing you need to do is to click attend to patient. So in this very demo, I will use attend to patient via fingerprint to demonstrate this. So I click get started, and then the next thing you do, if you select this option to attend to patient, you click collect fingerprint. So at this point, you ask the patient to place their thumb twice on the fingerprint reader, and then when that is done, you click verify fingerprint, and the system will identify the patient, and then you can retrieve the patient folder by clicking get patient folder here. So when you arrive at this point, what you now need to do is to create new record. Remember, in this very demo, we're trying to see how to create patient record, and we proceed by clicking create new record. So when you arrive here, you have quite a number of set of tools displayed here. So for instance, you can do clinical clerking, you can make requisition, which include lab requisition, X-ray, ultrasound, CT scan, EMRI, and so many other forms of requisition. You can prescribe drug as well. You can refer the patient to other institutions for more advanced care if necessary. Also, there is delivery documentation, appointment tool, but in this demo, let me demonstrate with Pharmaceutical Care tool. So I have loaded Pharmaceutical Care tool here. I have so many tools embedded in this tool to use. Let me start with subjective data. So when I click subjective data, system will load subjective data input system for me, but then I have to select which of the subjective data input system I want to make use of in this documentation. So I go ahead and click patient complaint. You can see system has dropped it there for me to document patient complaint. I can also add history of illness. You can add family history. You can add immunization history. You can add allergy. Now we are still under subjective data. I can see all the information I've added here. So let me just go ahead and put new here, just for demo purpose. Family history new, just for us to see how it will flow in the database when we finish documenting. All right. So let's assume I'm done with subjective data. I want to also add objective data to this documentation. I can do that as well. So objective data, I can take the BP, which is, let me say, is 120/75, and then pulse rate is 72, respiration 14, temperature 36.5, oxygen saturation 100, height 1.8 meter, weight 80 kg, and then pain. Is there any pain being felt by this patient? So I can click no pain if that is the case. Then I need to put reference to better define this result and let one interpret it and understand the result of this patient better. So I pick the references. So depending on what is the outcome, the result, you can select the equivalent in the reference. If the result is normal, you select normal range. But if, for instance, the result is 180 over 120, above 120/80, you can select this range. If it's 130/80 to 139, you select the range. So since it's normal, I will select this. So the same applies to other ones. I go ahead and select all the applied references in this very patient results. So that is the references I'm adding now. Okay, so done with this. Let's go to lab. Assuming I run fasting blood sugar, I can do that. Let's say I did a malaria test and I did a high density lipoprotein cholesterol test. So I put out the result. Let's say malaria test give us, fasting blood sugar give us 75 milligram per dl. Then malaria give us 3 plus. Then it give us 60 milligram per dl. Okay. All right. So you can see we have done quite a lot of documentation on the subjective, objective, and even documented diagnosis too. We can say what was documented as diagnosis. Let's assume it's malaria. Okay. Then there's more information for us to put here. Can talk about assessment and impression. If this patient walk in with a prescription, so assuming the dose in question is too high, we have to define what makes us to believe the dose is too high. So you click on that. You have input for you to put your write-up as to why you believe that the dose is high. So you can put the information, say above the saline dosage for the drug. Okay, let's assume this is what I put here, and that's why I believe the drug is dose is too high. So with what I have done so far, remember, with this is just pharmaceutical care. We are not talking about writing prescription, the pharmaceutical care plan, recommendation, outcome of intervention, therapeutic monitoring and evaluation, setting up monitoring parameter, which is another very important input we need to do, or the pharmacist has to use to manage their patients. So this monitoring parameter is actually used to set up values that you have to be on the lookout for while managing your patient to actually see if they're making progress or not. So let me quickly put something there. Let's see how it goes. Let's say I put fasting blood sugar, and then the current value is, let's say, is 200 milligram per dl, and I intend to achieve 75 milligram per dl. And then another one is the high density lipoprotein, and the current value is 100 milligram per dl, and I intend to achieve 40. Sorry, let's say this is 10, and I intend to achieve 40 milligram per dl. All right, one more before we wrap it up. This time around, I want to add low density lipoprotein cholesterol, and I want to achieve, current value is 160, and I want to achieve 100 milligram per dl. So now that I set these values, if I load the therapeutic monitoring, you will find out that these values I have established now will appear there automatically, and it will remain there even after saving this document, so that in subsequent intervention I can actually manage this patient and see if we're making progress or not. So you can see therapeutic monitoring and evaluation. It has appeared here, but I actually keyed it in on therapeutic monitoring parameter, but it has migrated to pharmacotherapy monitoring and evaluation, meaning that I can now use these values I have set over there to manage this patient in subsequent follow-up treatment. And whenever I feel that this pharmacotherapy monitoring and evaluation I have set up is no longer relevant, I'll click remove to delete it from the system. So this is the much we can take in this demo, but you can actually see that there are more to it than what we have done so far. But to stop it here for now.